And we are delighted that the directors of the Indian Institute of Science, Indian Institute of Technology, Kanpur, heads of departments of IIT, Hyderabad, Mumbai, Delhi will also be participating. A session on artificial intelligence covers many aspects, challenges in clinical adoption, implications for critical care. And what I think is very important, a very senior IIT professor is talking on the limitations of AI. In this era of hype, I think it's very necessary that we need to know the limitations of AI. Digital health is being covered in its entirety. We are talking of digital pathology, standards and certification, which is a vital part in any healthcare entity, the role of the CIO, a story from the NHS, the world's largest healthcare provider, role of insurance, wearables, and of course, we are going to have case studies from Israel, Holland, the United Kingdom, United States of America, and so on. Transforming healthcare with drones. We are very happy that ATNF is already playing a role in this with the World Economic Forum. There is going to be a talk on this, blockchain in healthcare, and so on. I could go on and on, but for lack of time, I'll just talk about novel topics in operational research, tracking the next pandemic, confidential computing from Microsoft, conversational AI from Google, hyperspectral imaging, and so on and so forth. The Ministry of Health Singapore is sending a representative, as is the Imperial College London, and of course, wearables are the name of the game. And we have Fitbit talk to us, the very senior officer from Fitbit, talking to us on how exactly this enormous information is changing. There's a pre-conference workshop organized by Chime. As many of you know, this is a College of Healthcare Information Management. And a very interesting point is the quiz program. We have been doing this for the last 3 to 4 years, and every single correct answer will be getting a handsome prize. It is not just a quiz as such, but it is also a very educational point where the quiz master is going to substantiate with scientific data, and it's an opportunity for all the attendees to know how much they know and how much they don't know. And finally, ladies and gentlemen, for the first time, to the best of my knowledge, I have been associated this from the very beginning 10 years ago, we are going to have a humanoid robot. Gone are the days when robot was something which we read about in books. You will be able to interact directly. You will be able to talk to a robot with artificial intelligence. In fact, I think the word humanoid is more appropriate than the word robot. We believe in being future ready. We are not talking only of theory, and we will demonstrate to you how in the years to come, humanoids are going to be physically present both in your house as well in your hospital. I really think this is a fantastic opportunity. In 2 days, you are going to be exposed to cutting edge technology all over the globe from authorities in their field. We expect a diversified set of people. We are going to have startup companies, a separate set of 8 startup companies where the best of the best in the country are going to exhibit their startup companies. We hope there will be a few venture capitalists, CIOs, medical superintendents, CEOs of hospitals, students, etc. In other words, a diversified group of decision makers, people who want to learn, etc. I'll be happy to take any questions later on. Thank you very much for giving me this opportunity.
Thank you, Professor Ganpati. So as you could gather from what Professor Ganpati said, this is the entire ecosystem around healthcare being represented at these conferences. The dates are February 13th and 14th in New Delhi. I now request my colleague, Mr. Gaurav Gloria, to address us all. Gaurav is the Chief Quality Officer and Senior Vice President, Operations and Quality at Apollo Hospitals Group. Gaurav?
Thank you, Karan, and a very good afternoon to you all. As Dr. Ganpati said, even I'm very excited and happy to talk about the International Patient Safety Conference. We embarked on this journey about 10 years back for IT and 9 years back for patient safety under the whole umbrella of International Health Dialogue, because it's very important to talk about the important concerns that we face in the healthcare system worldwide. And definitely patient safety is one of the biggest concerns across the world. with WHO just talking about that, 1 in every 10 patients that is harmed across the world as per WHO statistics. And more than 1 million patients die every year with just because of the surgical complications. And patient harm remains the 14th leading cause of global disease burden across the world. I don't think I have to talk more about how important patient safety is in today's world. And hence at Apollo, we embarked on this journey to make sure that, what we have implemented at our hospitals, at our institutions, based on a lot of, processes and protocols with the right use of technology, and also measuring those outcomes in a right way to ensure that the patient safety is delivered at of the highest quality with great clinical outcomes. At that point of time, we thought that, it would be a great thing to share it with the world and the other hospitals, other healthcare systems, so that, we learn from each other, and at the end of the day, we provide safe patient care. We did this conference. So last year in 2019, when the last edition of the conference in 2019, for IPSC, we had about 1980 delegates and about 150 speakers who attended the conference in Hyderabad. This year, the theme of the conference is Dream, Design, Dare, which clearly means that, how are we dreaming the next level of patient safety and patient care over the next 10 years, 15 years down the line? How do we go about designing that whole piece on the care part, and then how are we going to implement it across different healthcare systems, whether it is primary, secondary, or tertiary healthcare system? We have confirmations for over 100 speakers for this edition of the conference, and our speakers are from the Apollo leadership team as well as from the largest healthcare institutions and organizations that support healthcare. We have confirmations from WHO, Joint Commission International, International Society for Quality in Healthcare, National Accreditation Board for Hospitals and Healthcare Providers, NABH, from other institutions and organizations like CAHO, AHPI, SEMI, ECRI, IHI, Indian Army. We also have confirmations from multiple hospitals, like AIIMS, PGIMR, Max Hospitals, Fortis, PD Hinduja, and also some experienced learned individuals like from the Oxford University. We have speakers from Bumrungrad Hospital, hospitals in Malaysia, Indonesia, USA, UK, as well as Thailand. So we do have confirmations from speakers, and we are really looking forward to, hearing them out and, learning from them as to what more can we do in the healthcare space based on the different levels of safety that they have implemented in their institutions. We are looking at about 1,200 to 1,300 participants for the International Patient Safety Conference. As Dr. Ganapathy said, we also have an exhibition space wherein we are going to have the newest technologies, products, and service demonstrations that the different partners that have come with us to have participated in the conference. Along with that, we have already received about 150 paper presentations from different parts of the world. We will have poster presentations as well as the International Patient Safety Awards in different focus areas on patient safety. This conference is aptly suited for CEOs, health and hospital administrators, for the policymakers, for different organizations, different levels of people in the organization, doctors, nurses, technicians, even for the students, and for anybody and everybody who wants to learn on patient safety and understands how patient safety is really important in today's times. The whole topics range from, from having multiple plenary sessions over 2 days. So we do have 8 plenary sessions. We do have 30 parallel tracks wherein we are going to focus on multiple topics, like the equitable care, use of technology, laboratory safety, radiation safety, quality improvement, design framework, equipment safety, engineering standards, dietary standards, facility design, and the whole part on how do we measure, monitor clinical outcomes, and how do we ensure that they are sustainable in a healthcare environment to make sure that we are delivering right care to our patients. We are also starting actually 10 days before the conference dates. We do have 8 webinars that we are going to run on multiple important and critical topics, wherein again, we have very senior leaders talking about on different topics on patient safety, followed by 5 pre-conference workshops that we are going to have on 11th of February at Apollo Hospitals, wherein again, we are going to talk, it's a full day workshop talking about multiple aspects of patient safety and sharing the best practices with the delegates. With that, I'll stop here and really look forward to welcoming all of you in attending the conference, learning from each other, and making healthcare safe for each one of us. Thank you.
Thank you, Gaurav. And as you would have heard from Gaurav, a lot goes into the delivery of quality healthcare, both that the patient and the family see and a lot that they don't see. So this will be a good exchange of ideas and for cross-learning. And with that, I now request Dr. Sangeeta Reddy to kindly address us all. Ma'am.
Namaste, good morning, Dr. Ganapathy, Gaurav, Karan, and dear members of the press. I'm extremely happy that, the world is in a better place and we are able to go back to doing things which are very important, which is building on quality and preparing ourselves for change. COVID taught us so much, but it's important for us to encapsulate those lessons and many more of the tremendously changing world and continue to apply it into healthcare. Healthcare continues to be one of the largest sectors in the world, and post-pandemic, I think the focus on healthcare is only enhanced. We did have a 2-year gap in COVID, and I'm sure all of you understand why we could not spend the time, energy, and effort which it requires to do a conference like this, because we were putting that time, energy, and effort into the changing needs of the community because of COVID, the vaccination, the telemedicine that we needed to do, the new platforms we put up. But we're back again, and we're back bigger and more excited than ever before with international health dialogues. As Gaurav and Dr. Ganapathy said, we started these conferences 10, 11 years ago because we knew that we were working very hard on something which was meaningful to healthcare, and patient safety and quality and information technology and the use of IT are 2 significant pillars in the future evolution of best healthcare systems. So we knew we had something special and we wanted to share. So from one conference, which was 200-300 people, it's continued to grow. I think this year we'll cross the 2,400 mark. We have speakers from over 50 countries. We have delegates from a lot more. So we are on a certain track. But the track is, this is not a conference. You've heard about the speakers, you've heard about the subjects, you've heard about product launches. This is a discussion of like-minded people. It is a club, it is a cult, it is a methodology to stay abreast and connected with the future of what is happening, which has a significant meaning to everyone who's interested or passionate in healthcare. So whether you're working in a small nursing home or a large hospital, whether you're in a clinic or a laboratory, whether you're in research or education, this conference has something for everyone. If you're a startup, there's some deep meaning in there. Apply quickly so that you can get into our startup showcase. We are picking just 17 or 20. I don't know how many we have time for, but we're picking 20 startups to showcase. Our product launch window is almost closed, but we are showcasing some of the new and most exciting products in the evolving field. So there will be 2 drones that we will demo that we believe have been validated and have the best bet for the utilization of drones in healthcare. We're definitely taking a big bet on voice recognition because we know that the doctor to patient interface is so important. So as we move into digital health records, we don't want our doctors to be only looking at the computer screen. They must connect with the patient, continue to look at the patient, but this voice recognition will transform the dialogue into the record. So many, many exciting new things like this, which are being dreamt, which we're daring to challenge some of the status quos in the healthcare system, and we're more than happy to share. So that's what this conference is about. This conference is primarily promoted by Apollo, but I must acknowledge all our partners, and there are many, many partners who are making this possible. So I thank our partners. I invite future delegates. I look forward to hearing and learning from our speakers, and I look forward to support from the press, because it is programs like these, where over 2,000 healthcare people coming together, many of the industry, Microsoft, Google, Ognito, many of these new age companies coming together from different countries. And that's why we've put this under the umbrella of international health dialogues. This is not just healthcare. This is health for the future of the world. That's what's being spoken about here. Thank you all very much for listening. And thank you in advance for giving this conference the right kind of visibility, because it is the window into the future of better healthcare for the world.
Thank you, ma'am, for your words. I'll now open up the floor for Q&A and discussions. I have received a text from Mr. Mohammed Balik. Yes, Mr. Balik, we will have the recording available.
You have Shivam and Rajneesh with their hands up. So Karan will announce a sequence.
Yes. Shivam, if you could please, Shivam, are you there?
Yes.
Hi, Shivam.
Hello. Hi.
Yes, hello.
How are you? How are you, Dr. Sangeeta Reddy?
Yes. So please, if you could just ask your question and who you would like that to be answered from.
So my question is to Dr. Reddy. Dr. Reddy, you talked about the COVID-19 pandemic and the lessons that we have learned. So how do you think, how prepared Indian hospitals and particularly Indian private hospitals are for future such pandemics?
So one of the big learnings, I think, Shivam, and I'm going to preface, your question with that, is that all of us have realized that we have a very important role to play, but none of us are alone. This was, every pandemic calls for public, industry, society, government, public hospitals, private hospitals to work together. And that is one big lesson which I think we're going to keep enhancing and improving. In terms of ramp up capabilities, staff, learning through new engines, connecting with patients on telemedicine, I believe most hospitals have got their act together. In terms of the usage of appropriate medication, I think the government's announcements on these, the work that we have done, you must have known that we created the treatment protocol or the Red Book. We had 72 updates of the Red Book during the course of the last 2.5 years. This was shared with more than 3,000 nursing homes. So things like this now, it may have taken us 3 or 4 months to start planning that. God forbid we get into a next pandemic, we'll be up in 15 days. Our rooms are already going to be connected because now we've realized the power and the value of connected rooms and using devices. We're doing that anyway for routine care. So the entire healthcare ecosystem, I believe, is at a high state of preparedness, but we don't know what we don't know. If the pandemic attacks in a completely different way, this one was a respiratory, if that is, a different methodology, then we have to relearn the treatment modalities. But the biggest lesson of we have to be together as society, we have to respond fast, we have to prepare on multiple levels, not just treatment and prevention, but proactive education and the overall hygiene and society involvement. These are lessons we've learned.
Right. Just one more question. So what are the changes that Apollo has gone through in these past 2 years that you think that, you're saying that we are in a better condition if COVID were to attack or, another pandemic were to attack? What are those changes that Apollo has gone through in these last 2 years?
I think the biggest one is really our digital preparedness. We currently have over 14 million people on Apollo 24/7. 6,000 of our doctors are on Apollo 24/7, so they can video consult. If their patient cannot reach them physically, they can video consult with them. This is one of the biggest changes. But besides that, Our diagnostic team, we have over 800 phlebotomists who can go to a home, pick up a sample, take it to the nearest lab, and post your record on your phone again, so you can talk to your doctor. Our proactive monitoring systems. So we have re-engineered our business intelligence tool to also work as a clinical intelligence tool. So continuous monitoring of clinical details and outcomes will give us early warning symptoms across the healthcare ecosystem where we operate. So I think these are the broad ones, but there are many others in terms of nursing engagement, nursing training, doctors. There are lots of others, but these are the highlights. Thank you.
Thank you, Shivam. Thank you, ma'am, for that. I have a question from Mr. Rajneesh Dey. His question is, who all are the key partners for the conference? What are the dynamics of partnership with policymakers, and how do you expect private and public hospitals to coordinate, and what will be the roadmap that is expected to emerge from this conference? So thank you for that question, Mr. Dey. Ma'am?
So Dr. Ganapathy has put the first level of answers out, that we have IITs partnering in terms of speakers as well as design thinking on the conference itself. We have the Telemedicine Society as a major partner for the conference. In terms of the patient safety side, there are other partners. The main ones is ISQA, which is the International Society for Quality, Joint Commission International, and NABH. So these are in terms of ideation on the clinical committee, as well as on giving us speakers and working together. You also have a very important body called CHIME. So CHIME is the College of Health Informatics, the executives. So CHIME is also doing this. The National Health Authority is endorsing the conference. We'll also have speakers from NHA. One of the most important sessions that we will be conducting is the policy and the rollout of the National Digital Health Mission and NHA and its implication and impact on healthcare providers. Nat Health and QAI are also partners. This is all on the chat box, so you can take it directly. Gaurav and Dr. Ganapathy, thank you for typing this out.
Thank you, ma'am. Abhishek, your question, please.
Hello everyone, this side Abhishek from TV9 Bharata Digital. My question is that from last 3 years, we are very much focused on COVID only, but diseases like measles, cancer and heart problems are also increasing at very fast pace from past 2 years. So I want to know that how Apollo is ready to fight against this disease, not only COVID, but diseases also like heart problems and cancer especially.
So thank you for another really good question, Abhishek. I think that our fight against cancer, cardiac, and the entire realm of non-communicable disease has been an ongoing battle. During the height of COVID, we continued to treat cancer patients. We had a separate facilities, separate blocks, advanced safety for them. So radiation, surgery, none of that stopped even during COVID. But the biggest thing that we are pushing and promoting is screening, early detection, and prevention. So here, I think the media has been a very big partner, and we continue to look forward to your support. The thing that pains us the most is that when we find patients with a cardiac problem, why do 50% of our cardiac patients have more than 3 to 4 blocks? How can we help find them in stage 1? When their blocks are just beginning and we can treat them with medication. Worse is the case for cancer, where we find 70% of our patients in stage 3 and stage 4. So the greatest push is screening and early detection. I'm very, very happy to tell you that ProHealth, which is our proactive AI-enabled health checkup program, which goes beyond a health checkup to become a health maintenance program, is now this year targeting. We last year did over 7 lakh checkups. This year we are targeting to double that number. So we have opened new centers, we're partnering with others, we're sharing our IT. And in the conference, Dr. Ganapathy has put this as well in the chat box, there are 5 specialized onco areas that we are looking at, specifically in terms of early detection, screening, and biomarkers. Because if you can get a blood sample testing for early detection of cancer, the chances of finding this are far higher. So we're looking at this in an integrated manner, but also on the IT side is the aspect of if you can digitalize faster and better, you will enhance research. With greater data and research, you will accelerate drug discovery and novel discoveries.
Right.
So that continues. We have to keep focusing on non-communicable disease and prevention.
Thank you, ma'am. Thank you, Abhishek, for your question. Somrita from the Times of India has a question on how technology can help tackle the next pandemic or another pandemic in India.
So this is at various levels, and Dr. Ganapathy, please feel free to add after this thing. So number one is really the screening and early detection. We now have heat maps or health heat maps. So if you see pockets of a certain disease coming up, this will highlight and make health administrators at the government level and some at the private level look further. So maybe we will be prepared faster. A faster approval cycle in terms of drugs is one more thing which the government has enhanced. And like I already mentioned earlier, the entire aspect of using technology to care for remote care is and has enhanced the knowledge and the capability and the treatment in rural India. Another important aspect which I think got highlighted and has improved considerably is the entire supply chain. So whether it was what we went through in terms of oxygen to our enhanced oxygen safety and security for the country, greater research and scaling up of vaccines and other drug manufacturing, disruption in the routine global supply chains and the manufacturing in India with the PLI scheme, all these has strengthened the Indian healthcare system.
Right. Ma'am, there's a question from Sushmita from the Financial Express, and she asks about Apollo's approach to tackle AMR, antimicrobial resistance, which is a rising public health challenge, and what more needs to be done with control to the rise of zoonotic diseases.
So I'm going to refer this one to Dr. Ganapathy, but I do want to say that one of the critical aspects of AMR is appropriate use of antibiotics. And in that, Apollo has created, which we are sharing with other hospitals, is an AI-enabled protocol for appropriate antibiotic use. So this is one step towards the overall problem, but Dr. Ganapathy, over to you.
A very important thing is the tremendous awareness of AMR. Even doctors were not aware of this really a couple of years ago. And I think the media has played a very important part. Most even secondary and tertiary hospitals now have antibiotic use systems. And the Government of India Department of Biotechnology, BIRAC, in which I'm also involved, has funded many projects with very good results coming. So I think antimicrobial resistance, the awareness is the single most important thing. And once you are aware of it, it's more a preventive mechanism rather than using technology. It's a change in human behavior. Patients also, I'm sorry to say, are to blame. Most of us take antibiotics for 2 days, we get better, and then we stop it. Another major thing which the government hopes to introduce is to ensure that antibiotics cannot be obtained over the counter. I think the single method will go a long way. Kerala state government is imposing this. And I think if this single step to ensure that antibiotics cannot be obtained over the counter will go a long way. So rather than technology, I personally as a clinician, I feel it is a change in human behavior, both from the patient's perspective and from the prescribing doctor's point of view, which needs to be informed. I remember a very senior nephrologist once told me that 75% of kidney transplants are because of iatrogenic kidney damage due to improper use of antibiotics. So this is to be taken very seriously.
Right. Thank you for that, Dr. Ganapathy. If there are any other questions, you can please put them on the chat box.
Karan, I want to say a brief thank you to everybody and excuse myself. Thank you all very much. It was a pleasure and look forward to your continued support.
Thank you, ma'am. Thank you for joining us today. If there are any other questions, you could please unmute yourself and address it to one of our experts here. Right. So if there aren't any other questions, please feel free to write in to us. If you do have any follow-up questions, we'll be happy to get you to speak to one of our experts and also get you those answers and information. And with that, I'd like to draw this.
Dr. Karan, if I may just,
Sir.
if I can just make a remark, in case anybody is interested, there is whatever I mentioned in much more detail is available as a 4-page PDF document, which gives specific details, because it may be difficult for the attendees to remember many of these things. So if anybody is interested, a PDF document can be obtained from, you can ask Ashish to give it to anybody.
Sure, thank you for that. And the website where you can get more information is patient-safety.co.in. So please do log in there to get more details of the agenda, etc. Okay, so before I just sign off, there is one more question, so we'll just take that. Sanjeev from UNI, with consumers strongly embracing digital technologies, are Indian hospitals really ready to embrace digital capabilities? Dr. Ganpati?
Again, a very good question. As you know, one needs to be future ready to survive. So it's essentially a question of survival of the fittest. So no Indian hospital can even survive. So they have no choice in the matter. You're absolutely right. They jolly well be ready to embrace digital capability. Otherwise, the person will go to the another hospital. So purely from a survival point of view, hospitals necessarily have to be future ready.
Right, thank you for that. I think, Soumya, that also addresses your question. So the websites are there on the chat box, patient-safety.co.in, transformhealth-it.org. To save the dates, February 13th and 14th at Taj Palace in New Delhi, and we look forward to welcoming you there. With that, we'll bring this to a close. Thank you, Dr. Ganpati. Thank you, Gaurav, for being here with us. And thank you also to members of the press. And thank you for always taking the message of good health to the citizens of India and indeed the globe. With that, we draw this to a close. Thank you. Have a wonderful day ahead.
Thank you, everybody.
Good day. Thank you.